Yields back. Now recognize the gentlelady from Arizona, Ms. Lesko, for 5 minutes of questioning, and she's also the vice chair of this sub. Thank you, ma'am.
Thank you very much. Thank you for being here, and I guess you've had a long day. I have too, but you're on the hot seat, I guess. I have a couple questions. The first one, does United Healthcare and Change Healthcare have its own cybersecurity employees?
Yes, they do, Madam Vice Chair, yes.
Okay, and what vendors, if any, did you use when this breach happened?
In terms of the response to the breach, a number of different vendors, but most notably, I would say Mandiant, Palo Alto Systems, and a company called Bishop Fox, but many others, including the significant technology companies, but from a cybersecurity advisory capacity and testing capacity, those groups. And I might add also that we've now asked Mandiant to become a permanent advisor to the company, in fact, to the board of directors, to make sure that at the very top of the company we have the most elite cybersecurity advice available.
Were they working while the breach happened? Were they on one of your vendors while it happened, or that was after the fact?
Those are vendors who were brought in after
Okay.
the attack.
I was just curious. I'm just curious who the vendors were that were supposed to be doing cybersecurity for the company so that people would know, are they doing a good job or not? So do you know who the vendors were?
I'm afraid I don't.
Yeah?
I can't.
Okay.
Don't have those names for you today. No.
Okay, sounds great. And I think you've said you've reviewed your decisions on cybersecurity. Have you come up with any analysis of how you're going to change things besides using Mandiant?
So thank you for the question. So first of all, we've brought into the organization supplemental screening capabilities with third-party organizations, so making sure that we have secondary and tertiary level screening going on in the organization in addition to our own capabilities. And we're also reviewing through our investigations any lessons learned from this attack, which will obviously not only be implemented across United, but we'll share with other partners in the system.
And did your insurance cover the cost of the ransomware?
We're self-insured in this situation.
I have a switching subjects a bit. I've gotten letters on this. This is why I'm asking it. Does AARP get a paid percentage on your AARP United Healthcare Medicare Advantage plan? Do they get a cut of it?
I do not have the details of that arrangement. It's a very long-standing old arrangement, but there is an economic relationship. But I'm afraid I do not have the details. I would not like to give you an incorrect answer.
Okay, could you just make sure that the committee has it, because I'm getting all kinds of letters about it. And then my last, it's not a question, it's just a comment. This was a few years ago, but when I was helping my mother sign up for Medicare. It was very difficult, all right? And so she ended up using the AARP United Healthcare Medicare Advantage plan, but I have to say the listings that the insurance companies had for the doctors were not very accurate, like who was covered. So for instance, I remember like it was listed, a doctor was listed as a primary care doctor, but when I called them to make sure they were still taking patients, they were a cancer specialist or something. So I would encourage not just your insurance company, but all the insurance companies, that it is extremely confusing for me, let alone my mother. My mother wouldn't be able to do it, I don't think, at all. And if there's any way you guys can fix that, I would greatly appreciate it.
Well, I very much appreciate the observation. I agree with you. Provider directories, that reliability of provider directories to make sure a patient, when they walk into the reception of the facility, knows they're going to be accepted is super important, and it's not good enough. We would love to see that improve. We're working hard ourselves, but it's something we all have to do in partnership, and we'd certainly like to work with policymakers on this as well, because it's really a national challenge.
Yeah, well, I appreciate you coming here. I know this is a problem, but it's not just your company that's been breached. I mean, probably get a letter maybe every 3 months saying something's been hacked into my information and, oh, I'm going to give you, you know, a year's worth of credit agency. And I was like, well, that's not going to help me very much, but okay. But it's not just your problem, it's a problem nationwide, worldwide, and I don't know how we're going to address it, but we got to. Thank you.
Gentlelady yields back, now